Hello, good evening, everybody, and welcome to Health Alliance Network live on this Wednesday evening,
This the week before Thanksgiving, right?
the week before Thanksgiving. And I like that we do these on Wednesdays because Hump Day is a great day. I love Hump Day.
It is a great day. I want to have a relaxed look about me today. Do I look relaxed today?
Look kind of relaxed. Well, you were just sleeping, so
yeah. And you get me out of the bunk bed.
Every by the way, sorry, segue. Every Wednesday morning, I wake my kids up to that Geico commercial because I know we're going to talk about Insurance Day. I wake that Geico commercial with the camel walking through with the humps. Guess what day it is?
Hump day.
Okay, so there you go.
That's right. Speaking of segues, I have a segue.
You have a segue
In the garage.
I know you almost run me over.
Yep.
Thank you for attending. Sorry for the conversation here, but we take our business very seriously, but we don't take ourselves seriously. And who are we to say that we take our business seriously? We are Health Alliance Network. We are a health and wellness company providing online doctor visits using your smartphone, your computer, or your tablet. You connect in minutes to one of our general practitioners, pediatricians, dermatologists, behavioral health therapists, psychologists, psychiatrists.
I feel like I've heard this somewhere before.
Somewhere. It sounds vaguely familiar. You can do this 24/7, 365 in all 50 states, in Puerto Rico, across the nation, anywhere, anytime.
Does it look dark in the studio tonight to you a little bit?
I don't know. Is it kind of dark?
There's a lot of studio lights out here, but it looks a little dark.
Did you get a tan?
No, just the audience taking away from us.
Well, also included in our program, which I have a chance to say, is our prescription benefits plan.
Yes.
Of which you will find many prescriptions for free.
In fact, we were looking at a statistic today. We were talking to the University of Miami, as a matter of fact. And yeah, we were. Thanks for moving that camera. We were talking to the University of Miami, and they want to know about our prescription benefit program. And we gave our statistics that 67% of our visits result in a prescription. It's being issued by the telemedicine doctor, and of those 67%, 80% are zero cost prescription.
Zero cost. So the prescription benefit plan is serving its purpose.
It does its purpose. 80% of the prescriptions that are issued cost our membership nothing whatsoever.
So they have no copay, no deductible, and very often prescriptions are free.
Right. Absolutely. A couple of things we're going to talk about tonight. We're going to talk about three things. We're going to talk about insurance in general. That's kind of a sore spot with all of us. We're not an insurance company, matter of fact. We're a telemedicine company, not an insurance company. And then we're going to talk about the college kid healthcare just a bit.
Very exciting
subject. And then we're going to close. We're going to talk about Sophie. And if you don't know what Sophie is, stay tuned. I think you're going to have a big surprise when we roll Sophie out here tonight.
Sophie's on standby.
So let's get started. Let's talk about insurance. Let's go there for the moment.
So insurance. What are areas of your life that you have insurance? Name one.
Car,
house,
renters. My favorite. Life
and yacht
insurance, right?
And disability,
health insurance.
So everywhere, all aspects of your life have some level.
Let me ask you a question.
Insurance.
Let me ask you a question.
And that cool watch you have.
I do have too. This is insurance. That's right. I have Apple Care on my watch. Let me ask you a question about insurance. Insurance is the necessary evil in today's society. We need insurance on our car, our house, our health, our life insurance, disability insurance, business insurance, all those insurances that we need. So it's necessary. But let me ask you a question. Out of all those insurances that we talked about, Steve, which one of those would you like to use the most? That's a tough one, right?
None of them. All of them, every one of them, if I use it, it means a problem.
It's a problem, right?
It's a massive problem.
If you use your car insurance, you've had an accident. If you use your health insurance, you're sick. If you use your homeowner's insurance, you probably have a big problem. If you use your life insurance,
you get the biggest problem.
You have no problems. Everybody else has a problem at that point.
And what happens with all those insurance, except for life, what will happen is the more you use it, the higher the cost is going to be.
That's correct.
So you're going to have a lot of out of pocket, and then you're going to be penalized effectively is what it is for you using what it is that you're paying for.
It is. It's strange. We talk about utilization a lot when we're talking about insurance and telemedicine and what we do. The interesting thing about it is when you have health insurance, that's generally who we compete against, is the healthcare plans. When you have health insurance, it doesn't matter whether you use the health insurance or not if you're part of a group plan, because anybody who's using your health insurance will drive the rates up. The rates are going to go up. The costs are shared proportionally. Doesn't matter whether you used it once or none. If you have a high utilizer, your health insurance premiums are going to go up. So what do? We come in and we say,
what we say is, if you use our telemedicine program, what will happen is we will have the ability to lower the utilization of your overall healthcare plan as an employer. Why? Because a lot of healthcare is based on your day-to-day usage of doctors, and where you're going in for your flu and low acuity, low, things that you go to an urgent care for, general doctor for, not so much a break or a stitch or something more severe, but things are in the day-to-day is where a lot of your cost comes in too. As well, if that's a lot of utilization, all these appointments that are happening, it drives utilization up, which insurance company loves.
And drives your insurance rates up.
So by putting our telemedicine off to the side, coupled up with it, you can offset a lot of the utilization that occurs in the plan onto telemedicine, thereby reducing the utilization of your healthcare plan. And by reducing utilization, you reduce the cost.
The cost. The expense for next year. Absolutely. Now, we're not suggesting that anyone doesn't have health insurance. What we're saying is do it smart. Get a smart health insurance plan. If you're a business owner, you have group insurance, even if you're an individual and you have health insurance, get a standalone policy. Welcome, Vicki, to the call tonight. I forgot to say welcome and thank you, Jessica. Well, we have a lot of people on the call tonight. Thank you very much. Get a standalone telemedicine policy plan with us, because it moves that utilization from your health insurance off to the side, just like you said. So now you don't have to go to the primary care physician for cold, the flu, the sinus, the earaches, the strep throat, UTIs, upper respiratory infections. We could go on and on and on for hours, all the things that can be treated via telemedicine.
They found that by using telemedicine plan as part of your package, telemedicine, especially that's off to the side, you can reduce urgent care / ER visits by 36% for an employer.
That's correct.
Nope.
36%.
Tremendous decrease as an employer, the amount of usage in your plan.
And that Cigna study that we just got last week, Cigna itself studied 20,000 of their own customers that had telemedicine and 20,000 that did not have telemedicine.
Yep.
The overall savings for the group that had telemedicine, their health plan cost savings went down 17%. That's a huge number. 17% cost savings on your healthcare plan, when usually it's going up 10, 12, 13%, not dropping 17%.
Yeah, the funny thing is too, like talk about the cost of healthcare. One of the quotes as to how much one of the companies saved, $800,000.
$800,000. Yeah, that was Cigna's study. that we compete against, so we sell against Cigna. And we say, if you have telemedicine embedded in your health insurance policy, great, just leave it there, because it's probably not worth the paper it's written on anyway.
No. If you can find the paper.
If you can find the paper, absolutely. And one of the things we also learned, because we interviewed a lot of the health insurance companies this past week, we were at a symposium, they attended our symposium. What we found was that their telemedicine policies that are embedded in their healthcare mirrors the PCP deductible.
Right. So if you go to your general practitioner or your pediatrician for your children, and it costs you $50 as your copay, your telemedicine in that plan will also most likely cost you at least $50.
Exactly. I'm sorry to switch the camera over there. Don't do that.
I got a little.
Yeah, right. Exactly. So what Steve just said, if your copay, your office visit copay is $50, your telemedicine copay is going to be $50 on your health plan. But our Coldplay, that's a band. Coldplay. Our copay with Health Alliance Network is zero. Absolutely zero.
Always be zero.
Always be zero. We love that. We love the fact that we don't have to charge our members anything at all to use the service. They can use it once, twice, 100 times a month.
3 times a day.
3 times, that's right. Our utilization right now is one of the highest in the industry. I'm talking about Health Alliance Network's utilization, because we push it. Use your telemedicine. Just a couple of days ago, I called a friend of mine. And when he answered the phone, I said, dude, you sound horrible, absolutely horrible. What's wrong? He goes, I got up this morning, I had cold sweats, the sheets were wet, I was sweating, I feel horrible. I think I'm getting the flu. I said, you have telemedicine. I know you do. You're one of our customers. He goes, I do. And he goes, I know. I said, just promise me right now you will stop what you're doing and call a telemedicine doctor and see if you can get a diagnosis. He said, okay, I'll do it right now, Steve. The next day I called him back. And I said, you sound a lot better. He said, it was the flu. And as you guys know, if you don't catch the flu early on in that first 24, 48 hours, you got a full onset of flu and you got a problem. He got a diagnosis for flu. He got a prescription for Tamiflu. He took it that day. The next morning, he said, I felt 100% better.
And he was able to finish our contracts.
Yes.
He was our word.
I didn't mention that part.
But, you know, so, and going on to what you said about utilization.
Yes.
How ours is the highest that they're aware of, if you will.
Yes.
And they're tracking everything, so it is the highest.
Yep.
Their admitted utilization less than 1%.
Yeah, right.
Less than 1%.
We were at the same meeting.
Yeah. So there was a reason for that. A couple of reasons. One, they don't push it. Why?
They don't want you to use your insurance at all.
They don't want you to use it. And I don't want to get to the politics of it all, but there's a lot surrounding the fact of telemedicine being the disruptor, and it is a concern for the insurance companies how much of a disruptor it actually is.
Yeah.
But for our members who use it, they're all about the disruption because they're saving money. They're having healthcare on their time.
But let's talk about disruption. Let's talk about some big disruptions. You know, a few years ago, not very long ago, about 10 years ago, if you wanted to watch a movie, what did you have to do?
I went to Blockbuster.
Blockbuster, right? You got in your car and you drove over to Blockbuster and you looked through the movies and you found one. If it wasn't sold out, your favorite movie just come out, and you rented the movie and you paid for the movie, then you paid late fees, and eventually you got it back over there and you got another movie. Blockbuster that was worth $65 billion when Netflix entered the market. Here's Blockbuster, $65 billion. Here's Netflix with no movies, no assets, nothing, with an idea just to stream movies to your smart device or your TV. And what happened to Blockbuster?
They ended up with a large number of video cassettes.
You had a lot, right? I think there were DVDs. So
right?
Maybe, I don't know. Blockbuster doesn't exist any longer. I understand there's one store somewhere.
There's one store
in Minot, North Dakota or something. But
it's a museum.
It's a museum for Blockbuster. And talk about other couple of disruptors in the industry. And here's why this is important, because the way that you rented movies is gone. The way that you do shopping, no one goes, I shouldn't say no one, because it's time here when everybody's going to be doing it. But generally speaking, you don't get in your car and drive to the mall to pick up something. You go online and you order it online. Amazon, the biggest disruptor in online shopping.
And now they're moving to New York.
Now they moved to New York. I saw that. They did. Let's talk about one of the things that we promised you tonight that we were going to talk about, and that is college kid healthcare. Huge market. What we found out that about 60% of kids in college have no access to healthcare whatsoever. None at all. So let me show you a little screen here. This is kind of important. This is our college kid healthcare screen. And we're going to put it right out front to you how much it is, because it's on the screen right now. College kid healthcare. We have developed a plan for the college kid, for students, whether it's a college student, we call it college kid healthcare because that's the most likely user of our service. It could be an online college kid, but we have a plan that we have rolled out. We've just rolled it out today, $12.95 a month for coverage of your college kid or student, whether it's an online college kid, whether you're going to a college, whether you're from Florida, going to North Dakota to college. It makes no difference. It's $12.95 per month per child in college.
Anywhere, anytime.
Anywhere, anytime. Unlimited medical, unlimited dermatology, behavioral health, of course, our free prescription benefit program. How does it get better than that? Speaking of Netflix,
the only way it gets better is if my mom pays for it.
If your mom pays for it, right? Exactly. But whoops, sorry guys, somebody switched the tab. There we go. It's back. When do you get sick? You're in college and you're going to school, you're going to class during the day. You don't have time to go to the doctor. You can't miss your class. You get sick after class on weekends, 2 a.m., 2 o'clock in the morning. What better way to visit a doctor when you're not feeling well? You got a cold. When you're in school, I don't care if it's grade school, middle school, high school, or college. When you're around other sick people, you're probably going to get sick.
Yeah, true. And usually it happens to the college students more often closer to finals because of the high stress. And that's when
very much so.
With two things. One, that's when they get sick more often. And two, that's the least desirable time to get sick because you're trying to study and doing these 2 and 3 a.m. polls to get ready for finals.
It is. I know. I remember when I was in college and doing all-nighters and just absolutely exhausted. To find out about our program, I just put it on the screen, collegekidhealthcare.com, collegekidhealthcare.com. You'll see something there that, right, if you can see my little green button there, it says push the button, and that'll take you right to the page to enroll.
Mm-hmm.
You can enroll your college kid, $12.95 a month. It's amazing.
As well as if any of our agents are on the call, it's on the main website. Into health plans, it's one of the new health plans, one of about 6 or so that are there now.
Yep,
keeps expanding, so you can do it from your website as well.
We're very excited about the opportunity that we're bringing. We had, as I mentioned earlier on the call, we had a talk today with University of Miami. Very excited about college kid healthcare.
Mm-hmm.
60% of college kids have no access to healthcare. If they do have access to healthcare, they're on their parents' policy. And guess what? You still don't have access to a primary care doctor at 2 o'clock in the morning or Saturday afternoon.
Yep.
You still got to go to urgent care. Still have to go to urgent care. So the thing we want to remind you of is that we are just launched collegekidhealthcare.com. It's powered by Health Alliance Network. It's part of our same program, same benefits as our full family plan, but we pulled it out and we're offering it to college students, whether it's an online college student or you're attending a college or university, at $12.95 a month.
Right. It's only good for the one student.
One student. That's
one
right.
student per plan.
That's right. So if you have 3 kids in college, you might want to go ahead and get our family plan, which is $35 a month, and it's going to cover all 3 kids plus the parents. Let's talk about Sophie. Go ahead, ask me. I know you want to ask me this question.
Who is this Sophie?
Who is Sophie?
And does your wife know about her?
My wife does know about Sophie. Sophie is something that have been developing. We're working on in connection with our distribution partners. Sophie's going to be rolled out the first quarter of 2019.
Mm-hmm.
And if you don't mind, let me put a little bit about Sophie on the screen.
A little teaser, just a little teaser.
We're going to show you just a little bit about Sophie. We're going to play it. Hopefully I can play it. And what we're going to do is show you a little bit of a demonstration of Sophie. Sophie is an intelligent bot.
Mm-hmm. And pay attention to the man you will see talking to his wrist.
He's going to be talking to his wrist so he can get Sophie. And the interesting thing about this, hopefully you'll be able to hear the conversation. Let me just roll the tape. It's about, maybe it's 30, 40 seconds. Let me roll a little bit of the tape. Let's see how it comes out.
Have you been compliant with your medications? Are you still taking Avapro, Lasix, Metformin, and Trulicity?
Yes, I am.
I see. Have you been eating any differently?
Well, a little bit. Last night I went out to a Chinese restaurant and had some spicy food and ended up finishing with
Got it. How are you feeling? Any shortness of breath, chest pain, or leg swelling?
no shortness of breath or chest pain. However, my ankles do feel like they're a little bit swollen.
Calm. I recommend connecting to your virtual PCP, Dr. Deborah, to review your case and come up with a plan. Should I set up an MD line call?
Yes, I would appreciate it.
Okay. Connecting to Dr. Deborah again.
You're live.
Oh, yeah?
Amazing.
We're going to switch back to our screen now because we just want to give you a taste of what Sophie's going to be about. And it's as simple as that. It's really as simple as that.
It's going to be somebody, it's going to be effectively your own personal concierge health monitoring person.
Health and wellness concierge, exactly. Yep. What you didn't see in the beginning of that is that our test drive dummy on stage there stepped onto a scale. The scale broadcast the weight and body mass index to the watch. Sophie can read all of that information because it gets transferred over to the intelligent interface.
Mhm.
Sophie reads that and says, oh, you look like you've gained 5 pounds. What have you been doing differently? And so forth and so on.
And the next big wave of what's going to be happening in telemedicine, keep an eye out for wearables.
Wearables.
Anything wearables. There's going to be patches on you that are wearable.
Mhm.
There's tattoos that are wearable. If you're that trendy, there are watches. There are all kinds of devices available that are all going to integrate together, where Sophie is going to have the ability to take all this information and then work out the right plan based on the data she's receiving specifically just for you.
For any of you that haven't actually used the telemedicine program, and if you haven't, it's because you didn't need to use it, because we know you have it out there. That screen that you see is just how it works. You'll see a little screen in the bottom there, and that's the image of the person that the doctor's talking to. Obviously, the doctor's the larger image in the screen, and the doctor can diagnose your symptoms and issue a prescription if necessary. It's just that simple. It's absolutely amazing where the technology is and where it's going. Hopefully, everyone in the audience was able to hear the audio. We're not sure if you could or not hear it. If somebody could just let me know, just write a little note in the box if you could hear the audio from Sophie speaking with our test drive dummy.
She has such a soothing voice.
She does. You just want to listen to her. That's right. Another interesting story is on that screen. This is I call her Dr. Debbie. Dr. Debbie has done 18,000 online visits with this program.
That's how she runs her business.
That's all she does is she does telemedicine. That's her only business. In the last, I think 2 years or maybe 3 years. The last 3 years, she's done 18,000 online visits. That is absolutely amazing if you think about that. And it's as simple as that. This is the future of healthcare. Do you remember the story that they told about Dr. Debbie here? If you do, about she was taking a call with somebody with flu symptoms. Remember that?
Oh yeah, and then there was just the person who had all the other symptoms, and so that as she was evaluating and diagnosing this person, she said, you sound like you might be having a stroke.
Right.
And she goes, right away, go ahead.
I hate to cut you. Let me clarify that. The person called in telemedicine with flu-like symptoms. I think I'm getting the flu, doctor. I have a fever. I have this. I have this. Now, let me tell you why this is important. Dr. Debbie recognized something was wrong. And she said, by talking to the patient, she said, I believe you're presenting symptoms of a stroke. And I suggest you go to the emergency room.
And that's interesting because she has the ability to spend more time with patients than normal,
right?
Than like a normal office visit.
Exactly.
So
right.
she was able to really get to know the patient in those moments, evaluate in visual aspect because this person was doing the video call. So she was able to kind of see his reaction to things. And then in that note, she realized that there's something more going on than just a flu. She had the guy call emergency.
Yep.
So he went to the emergency room. No, they came and picked him up, right?
Yeah, they come and got him.
No, they called the ambulance. He was home. They came and picked him up, brought him in. He was having a stroke. They got it so he did not suffer the overall consequences of a full-on stroke.
That's right.
And he recovered. And
the emergency room said that Dr. Debbie probably saved his life, if not his life, the fallout of having a stroke.
And they stayed in touch after that, actually. So she whatever he gets on to get a doctor, he makes sure he's always connected to Dr. Debbie.
You can always pick your doctor.
You can select your doctor.
You can select your doctor with our app. Guys, it's been a great evening. We've gone a little bit over the time that we allocated. Let's reiterate what we talked about tonight. We talked about insurance, the necessity of having insurance.
We love insurance.
We love insurance. We love it because we love health insurance because we get to sell against health insurance. Do you want to pay $1,000 a month and not use your health insurance, or do you want to pay $35 a month and use it as much as you want? That's my
penalty.
Without a penalty whatsoever. And we touched on the College Kid Healthcare. College Kid Healthcare, go to collegekidhealthcare.com. You can also find it at Health Alliance Network. If to our agents, if you share it out from your website at Health Alliance Network, it will be credited back to you. You'll get credit for the referral back to the website. The last thing we talked about was Sophie and online doctor visits. very, very strong. We had a strong evening of information tonight. We hope everyone has a great holiday. Next weekend, or next Thursday is Thanksgiving. We hope everybody enjoys it. And as always, be kind and be grateful. Good night from Steve.
Good night, everybody. Thank you so much for attending, and I hope you learned a little something in your evening with us.
Thank you so much. Good night,
Good
everyone.
night. Thank you.